This introduction to the thyroid was created by Beyond 5 for the benefit of patients and families affected by thyroid cancer. The thyroid is a small gland in the front part of the neck below the voice box. It is shaped like a butterfly with two lobes lying on either side of the windpipe. The right and left lobes are connected by a thin piece of tissue called the isthmus, which sits on the windpipe. The thyroid produces hormones that are released into the bloodstream and carried to every tissue in the body. These hormones control the speed at which your cells work. Having too much thyroid hormone, known as hyperthyroidism, can cause weight loss, a feeling of being too warm, palpitations, trouble sleeping, and nervousness. Having too little thyroid hormone, called hypothyroidism, causes your body to slow down. Patients may notice weight gain, tiredness, feeling cold, dry skin, constipation, and depression. If you have any of these symptoms, see your doctor to have blood tests to check the thyroid. The body needs thyroid hormones to function properly. Patients who have their thyroid gland removed need to take thyroid hormone tablets daily for the rest of their life. There are important structures next to the thyroid gland that have to be protected during thyroid surgery. First are the nerves that go to the voice box and control movement of the vocal cords. The most important nerves are the recurrent laryngeal nerves. The recurrent laryngeal nerves run behind the thyroid gland between the trachea and esophagus. If they are damaged by thyroid cancer or surgery, the vocal cords do not move properly, which usually leads to a weak, hoarse voice, and sometimes difficulty with swallowing too. The superior laryngeal nerves are also important because they control the fine tuning of the voice. Damage to these nerves tends to be noticed when you sing or project your voice in a loud environment. Second are the parathyroid glands. These glands control the level of calcium in the blood and bones. Normally, there are 4 parathyroid glands, 2 at the top and 2 at the bottom of the thyroid gland. If they are damaged or accidentally removed during thyroid surgery, the level of calcium in the blood may drop. This can cause tingling in the lips, fingers and toes, and sometimes muscle cramps. This is a medical emergency, and if left untreated can progress to dangerous effects on the brain, heart and lungs. When the thyroid is larger than normal, it is called a goiter. Lumps in the thyroid gland are called thyroid nodules. It is important to know that thyroid nodules are very common and only 5% are cancerous. Cancer that develops in the thyroid gland is called thyroid cancer. Most patients with thyroid cancer will have normal thyroid hormone levels, so thyroid cancer is not usually diagnosed by blood tests. Thyroid cancer is often found on scans done for other reasons, and most patients do not have any symptoms. Some patients may notice a lump in the neck. This may be a lump in the thyroid itself or one of the lymph nodes in the neck involved by the cancer. Less commonly, thyroid cancers can cause voice changes, difficulty swallowing, or a pressure sensation. Most often these symptoms are not due to thyroid cancer. However, anyone with these symptoms should tell their doctor so that problems can be diagnosed and treated as early as possible. Thyroid cancer is usually treated with surgery. Many patients also need radioactive iodine therapy. Depending on the size and the location of the cancer, your specialist will suggest treatment options that are suitable for you. For further information, please visit www.beyond5.org.au.